Hello and welcome. Today we're diving deep into a specific type of cataract, the posterior subcapsular cataract, or PSC. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. So, let's get started on understanding this sometimes rapidly progressing eye condition. So, what exactly causes a posterior subcapsular cataract? While the exact causes can vary, there are several key risk factors. Aging is a major contributor, as with most types of cataracts. However, PSCs are more strongly associated with certain conditions. These include long-term use of corticosteroids, whether taken orally, inhaled, or even applied topically to the skin. Diabetes is another significant risk factor. Other potential causes include prior eye trauma, exposure to radiation, and certain inflammatory eye diseases, such as uveitis. Sometimes a clear cause isn't readily identifiable, and it develops seemingly spontaneously. To understand how a PSC affects vision, let's talk about the lens of the eye. The lens is normally clear, allowing light to pass through and focus on the retina. In a PSC, the opacity, or clouding, develops on the back surface of the lens, right under the lens capsule, hence the name posterior subcapsular. This location is particularly problematic because it's right in the path of incoming light, significantly scattering and distorting it. The clouding often begins as small, granular deposits, which then grow and coalesce over time. Because of its location, PSCs tend to cause more vision problems earlier in their development compared to other types of cataracts. Posterior subcapsular cataracts account for a significant portion of all cataract cases, although the exact percentage can vary depending on the population studied. They are often found in younger individuals compared to other types of age-related cataracts. As mentioned earlier, people with diabetes, long-term steroid users, and those with a history of eye trauma or inflammatory eye diseases are at a higher risk of developing PSCs. It's also worth noting that certain genetic predispositions may play a role, although this area is still under investigation. The symptoms of a posterior subcapsular cataract can be quite distinct and often bothersome. The most common complaint is glare, particularly in bright light or when driving at night. This glare can make it difficult to see clearly and can be quite distracting. Another common symptom is reduced vision in bright light. Paradoxically, vision might be slightly better in dim light. Reading can become challenging, especially fine print. Halos around lights are also frequently reported. Because the opacity is located in the center of the lens, these symptoms tend to manifest earlier in the disease process compared to other types of cataracts, impacting daily activities more quickly. Diagnosing a posterior subcapsular cataract involves a comprehensive eye exam. This typically begins with a visual acuity test to measure how well you can see at various distances. The doctor will then use a slit lamp, a special microscope with a bright light, to examine the lens and other parts of the eye in detail. The slit lamp allows the doctor to see the specific location and extent of the cataract. Pupil dilation is crucial, as it allows for a better view of the posterior lens capsule where PSCs form. Other tests, such as a retinal exam and a test to measure the pressure inside the eye, may also be performed to rule out other possible causes of vision problems. While we don't typically classify PSCs into distinct types, in the same way as some other conditions, the term Christmas tree cataract is sometimes used to describe a specific appearance of some PSCs. In these cases, the opacity has a multicolored, iridescent crystalline appearance, resembling the decorations on a Christmas tree. This is usually related to specific metabolic changes within the lens, but doesn't necessarily change the treatment approach. The primary treatment for a posterior subcapsular cataract is surgery. Since PSCs often cause significant vision problems early on, surgery is usually recommended when the cataract starts to interfere with daily activities. Cataract surgery involves removing the cloudy lens and replacing it with a clear artificial lens, called an intraocular lens, or IO. The most common surgical technique is phacoemulsification, where the cataract is broken up using ultrasound and then removed through a small incision. The IOL is then implanted. The surgery is generally very safe and effective, with a high success rate. After surgery, patients typically experience a significant improvement in vision. While there's no guaranteed way to prevent posterior subcapsular cataracts, there are steps you can take to reduce your risk. Managing underlying health conditions, such as diabetes, is crucial. If you're taking corticosteroids, discuss the potential risks and benefits with your doctor and explore alternative medications if possible. Protecting your eyes from UV radiation by wearing sunglasses when outdoors is also recommended. A healthy diet rich in antioxidants may also play a role in maintaining eye health. Regular eye exams are essential for early detection and monitoring of any potential problems. The prognosis for patients undergoing cataract surgery for a posterior subcapsular cataract is generally excellent. most patients experience a significant improvement in vision and an enhanced quality of life. While complications are rare, they can occur, such as posterior capsule opacification (PSO), sometimes called a secondary cataract, which can be easily treated with a laser procedure. Research is ongoing to better understand the causes and risk factors for PSCs, as well as to develop even more effective surgical techniques and intraocular lenses. Some researchers are investigating potential pharmacological treatments to delay or prevent cataract formation, but these are still in the early stages of development. Thank you for joining us on this exploration of posterior subcapsular cataracts.